gonna need a car.
Would you settle for a bicycle?
And in December?
Studded tires. To your career. Adventure-filled, stress-free.
Dr. Wickens, call 4475. Dr. Wickens, 4475.
Monica, we're a little short today. Can you make sure Mr. Johnson in room 469 has been given his dinner?
Right away.
Dr. Sloan, call 2186. Dr. Sloan, 2186.
Hello, Mr. Johnson. How are you this afternoon? You feeling all right? Are you feeling all right? Oh, look. It's stew. Okay, here we go. Don't you want to eat today, Mr. Johnson? It's good.
How's it going?
He won't eat.
Oh, dear. Let me see what I can do. If you shut out the bright sunlight and then put the bed up. Could you pass me those pillows?
It wasn't too many hours into my career as a health professional before I began to realize how many people have trouble eating.
Just gonna lift this arm up.
The ability to swallow that we take for granted isn't something everyone can depend
Is that
on.
comfortable?
Some can't chew, some can't move the food around in their mouths. Some can't remember to swallow, and others can't make themselves swallow even when they want to. And some can't swallow without coughing or choking. When a colleague of mine sat down with me and explained dysphagia, difficulty swallowing, I realized how serious the problem was. People can choke and get food in the lungs. This can result in pneumonia, or if they can't swallow properly, they may not be getting enough food and can become malnourished. This is serious. But what she reminded me of was that there are many signs and symptoms of dysphagia, if you look for them. Sometimes the muscles in the face or mouth are too weak. You can see that if you look. Or they clear their throats a lot, or cough often when they swallow. Or maybe they drool a lot. They may not be eating because they're afraid of choking. Don't assume they're just depressed. Pocketing food is another problem, where food collects in the cheek or the back of the mouth. In many hospitals, the speech therapist can help identify the exact nature of the swallowing problem and then suggest ways to deal with it. What it comes down to is this. There are many people with swallowing problems. You really have to know what you're doing when you feed them. An occupational therapist would tell you that good positioning is essential. Think head forward, back straight, feet flat and well supported. Just think of how we eat. What does it take to swallow comfortably? First, your head has to be forward. Can you imagine trying to take a mouthful of something from someone standing over you? Wrong, it's just not natural. When you swallow, you like to have your head upright and tilted forward, not backward. And you can't eat all slouched over either. You want to be upright, or at least not falling over to one side. So when you feed other people, get them into that position before you begin. If they're in bed, raise the head of the bed up, at right angles if possible. Use pillows if you need them, especially to keep the person from falling to the side. And if that's not enough to get the head forward, use more pillows. Tuck a pillow or a roll underneath their knees if they tend to slip down. That should help, or you might want to crank the bottom of the bed up a little. And something just as important as position is the environment in which people have to eat. Atmosphere is important. Ask a restaurant owner. Noise and clatter get people agitated. If you have trouble swallowing to begin with, it's going to be even harder if there are all sorts of distractions.
How many times do I have to tell you? Don't throw them down! Just place them gently.
Eating should be calm and unhurried, which anyone who works in a hospital will tell you is next to impossible. But we've really got to try to set up an environment where people can be comfortable to move at their own pace. If the atmosphere is good and the patient is in a good position, things are going to go a lot smoother, but there's still plenty to think about. Is the meal the right one for the patient? Does it match the order? Is the texture of the food right for your patient? Liquids are hard to swallow, so jelly juice makes a good substitute. The foods themselves may have to be purees, in consistency somewhere between pudding and mashed potato. Foods may have to be smooth, moist yet heavy enough to trigger the swallowing reflex. You can always check with the dietitian for suggestions. And how much do you put on the spoon? Think about it. It could make the difference. It's good to begin with something cold and wet to moisten the mouth and make swallowing easier in general. Bring the food up to the mouth. Remember, never from above. Never shovel or just pour the food in. It's a lot better if the person takes control of the food in her mouth right at the start. Then you have to be patient. Rush things and you'll make the swallowing problem worse. Inevitably, there are going to be problems, but if a patient starts coughing, remember that the very act of coughing is an effort to clear the throat. Don't give her something to drink. That'll just make things worse. Wait until the coughing stops, then ask the patient to swallow again. Now, try and swallow. Make sure the throat is really clear, then give her something moist and cool to soothe the throat. If you're giving a drink, use a special glass so that the head doesn't have to be tipped back. And if you're using a cup and straw, pinch the straw to stop the flow of liquid. What's important to realize is that if a person coughs or chokes, something is wrong. So go through the steps again and try to figure out what the problem may be and then correct it. Is the patient in the proper position? Did she maybe slide forward or tilt sideways? Is the patient's head still upright and forward? Is the texture of the food all right? Maybe it's too dry or too thin. You can always thicken up a puree by adding a little mashed potato or rice pablum flakes. Mashed potatoes can be thinned by mixing in gravy. If you're having trouble with texture, Be creative, but don't just mush everything up together. Allow your patient to enjoy different taste sensations. Maybe your patient is drifting off, forgetting to swallow, or even going to sleep. Sarah. If the person is drowsy, try calling her name. Try wiping the face with a cloth, rubbing the shoulder, or stroking a cheek. That'll usually wake them up. And if the patient is not swallowing, place an empty spoon in the mouth. That often does the trick to trigger a swallow. If you're not sure whether she has swallowed or not, look under the chin and look for the swallowing motion. And it's important after you've finished feeding to leave the patient upright for at least 30 minutes to reduce the risk of choking from regurgitation.
It's your husband. I didn't know it was your birthday today.
Hi, honey. Oh, thanks. Dinner, I'd love it. A present? What is it? Okay. I'll see you tonight at 7, outside. Okay, bye. Eating is such a central feature of our lives. It's more than just nourishment. It's pleasure, entertainment. And having a meal is a moment so central to our lives that we share it with those we love and care about. So knowing how to help my patients enjoy eating has been one of the most satisfying things I've learned so far.
Madam, your present, your dinner, your date.
Oh, thanks.
You like it?